what I want to do is just provide the opportunity in case anyone has any remaining questions. I know we do have still our pharmacists here today as well as Karista, and we can certainly take a few questions if you like. I did also want to welcome up Charmaine, who always likes to come up and say a few words about how we can possibly take what we've learned here and implement it back in our clinics. Charmaine, you want to come up for a bit? You guys all know Charmaine, right?
I actually had a question.
I'm going to give you this one because
okay.
it's this way you're allowed.
And then I'll ask you guys a question. So, so what is the next step if you're in primary care and you've done the labs? So you have liver function that's abnormal, and then your RNA. What does the primary care doctor do? We refer. How long does it take to get to see you? What's that bridge from primary care to you?
So typically you just place a referral over, and then the providers will look at the patient's labs and make that decision. So our review process is we actually have the hepatologists doing the case reviews. So they'll be like, okay, does this look like it's stable? Do they look like they have more issues going on? And so then they will triage based on the severity of disease that they see. The other thing we wanted to make sure is if patients are still actively drinking, again, there's not much I can do for Hep C until that alcoholism is addressed.
So just to kind of put you on the spot, so if I refer today, when is my patient going to see you?
Okay. I don't know, I'm fine. Okay. I guess for other people. It just depends. So right now, our providers are about 3 months, 3 to 6 months. Mm-hmm. I know. So
what do I do as the nurse, knowing that my patient's not going to see anybody for 3 to 6 months?
Well, it just depends on what if their liver function tests were to a point where it couldn't wait, then we would see them like that. But just a routine patient, it will be about that time frame. I know it's hard, that waiting. I know it kills us too, but I know it's pretty typical for specialties. Yeah, exactly. That gives you your 6 months to stop drinking. Yeah. Exactly. Yeah, no problem.
So thinking back over the 3 sessions today, so we had the what is liver disease, the medications, and then as nurses, what do we do? What are you guys going to take back to your colleagues from the session today? What are your key points, colleague to colleague? Because I know all of your nurses that are in clinic with you couldn't come today. Somebody share with me. Yeah.
There was a reference to a criteria sheet in the back for the CCOs, but I couldn't find it.
Okay. I don't think there's one for the CCOs. Because everyone, I have a rough draft one. I don't know if I could send out, because I actually have gotten a lot of denials. So I've kind of made my own Word thing of what they needed. I could maybe send.
So I can kind of address that too. So I think there was just a little bit of a misunderstanding. So we had some information about readiness for therapy and kind of some of the assessments that people go through, but also our criteria are on the internet as well. So they can be accessed directly from our website for both Oregon Health Plan, which is Medicaid, and Medicare as well. So they're all on the internet. If that's something that you wanted more detail of, and if you had specific questions about where to find that, I can answer those after the session as well.
The CCO, like you guys are like really great about getting patients treatment. Like overall, it's some of the other more Southern Oregon is a lot more challenging. Their criteria are like 4 pages.
Yeah, Tran.
Beware of answer.
That's a great one. That's a great one. What else are you going to take back to the nurse that asked you in clinic? So what did you learn today?
I like the overall picture of chronic liver disease may or may not lead to cirrhosis, and then compensated, uncompensated, and looking at those clinical indicators of uncompensated and being able to offer reassurance to the individual who has more stable labs and is awaiting that specialty appointment. I think it's important for us to try to hold that space with them and reassure them it's normal, because I do get a lot of those panic calls. They're like, can't you call hepatology on my behalf?
Sure.
My line is.
Sorry, the 1500, what is it, the sodium, keep it at like Dr. said, and And if they need help with sending to a nutritionist or nutrition to, guide them better or provide as much educational material and go over with them and have them repeat and tell you what they learn and who to call and all that.
Mhm. Yeah, it was actually a trick question I was asking about what we can do in between. I was thinking about how my conversation with patients that have to wait 3 to 6 months is so much more knowledgeable now. Like I feel like I can really share some things that they can do to help self-manage before they get in to see the specialist.
That's the biggest thing I see is that we are a partnership. Even when we start people, is that they have to be their own advocate just as much as we're a partnership. And so I really try to drive that home. A lot of our monitoring is done in people's communities. So I have patients who are in Corvallis. I might not ever see them while they're on their therapies. So we really have this close relationship to make sure that we are communicating and that they know that we are here as their team. And I know that you guys are all really good at that.
So for the guy that had the train going through his head headache, what were the things that you did that?
So we started the low dose Tylenol and then pushing fluids, and it resolved after about a week. So most of these symptoms that we see are usually within the first month. And then as time goes on, they tolerate better and better, even Vicura. And so typically it's that first month. And if you can get them through that first month, it's so great because the treatments are 12 weeks for most, 24 for many for genotype 3, but that doesn't matter. So you're already through the first month, it's hard. You're through the second, and then the end's already in sight. So it used to be when I had patients 48 weeks, it's like, oh, we're almost, no, we're not almost there. So it's a totally different discussion.
I think another thing now I'm thinking is when they bring the med list, it's not just your regular, the supplements, anything extra that they're taking in the drug interaction as well, and for them to actually bring the whole bag so you can go over with them.
Yeah, I agree. Especially, obviously, if they're on treatment. Yeah.
Address alcohol use.
And how are you going to address the alcohol use? What did you learn today that's going to help, that changes the way that you're going to address that?
Well, we have behavioralists in our clinic, so I would connect them to the behavioralist and go, we have our expert screening that we do every day anyway, so hopefully we'll already know what their baseline is and look at their readiness to move them through that.
Do you guys have a list of, I think it's oregonsomething.gov that mentions all the rehab places that take Medicaid, and it's an online resource for, and it's by county, so that patients can kind of find resources for alcohol and drug help. It's all online, and they update it pretty regularly, so I don't know.
Is that something that you all have, are you familiar with that list, or do you have access to it readily? We can see if we can pull it and send it out when we send out
It's like
the...
oregonsomething.gov/HA, like it's really long, I can't remember. But that's been a really good thing because I can be like, oh, you live in this county, here you go, let me give you some resources. So, okay.
Anybody else want to comment?
The information about alcoholism and the cirrhosis and just kind of giving the visual to somebody who, they have a chance to improve themselves from going toward fibrosis in the other direction is maybe helpful for people trying to quit drinking, to realize that, they can maybe affect a change. It doesn't have to be all the way to stage 4 or, just that information about their liver and regenerating.
Yeah. As a nurse, I really like being able to share with patients things that they can do to really self-manage. I think that's so important, and I think that we're in a key place to make a difference for patients with that. Yeah.
I think a lot of times when people drink, they kind of just get in a place where it's sort of inevitable, and to kind of get them out of that, oh, it's inevitable thinking, maybe.
I would say the alcohol is like the gasoline, so you have a small fire and then you add the alcohol. And so I think that's a really good visual, like it's burning things. So if we can avoid that burning.
Just go ahead.
Is what their feelings are regarding the hepatitis C and the alcohol use, because they're completely incompatible. So I want to know what their priorities are. I don't think I can help them if their priorities are not fixing the disease, and they're more intent on drinking and the social circumstances that I can't deal with the one, then the chances are the patient's not going to do very well with it.
Absolutely true. Yeah.
Oh, keep some carnations and breakfast around.
Oh yeah, that was a huge one, huh? I would have never thought of that.
It's like
honestly.
$6 or
Never.
something for a thing. Yeah. I looked because he always says it. And I'm like, how much is this? Just like the other thing, Spike. That's a non-salt substitute for patients. I think it's like $3, and it doesn't have salt in it, but it has herbs and things that you can get. I think even Winco has it.
I don't think there's a sugar.
I'm assuming the SNAP program you pay for it, or will they not?
I think so.
Yeah, I think carnation would go under that.
Absolutely.
Oh,
Yeah.
snap, yeah. Well, thank you very much. It was great to see you all here.